I guess we are live now, so I'm just gonna share it. I guess we are live now, so I'm just gonna share it. Actually, sorry, I be volume on your book and tell it I share them to share from you because camera.
Kasha.
So it need about Jamaican from digest.
Laptop or use ka?
It a phone or baby lock no.
Ha.
Okay, it's fine. So about share that is okay. Because I have share na page also. It a financial share no ila phone or tele. Yeah.
On Facebook.
Ha.
Don't have Facebook what?
Just bear with us. Just sorting out few things.
So coming in for digest.
Actually, need to tell a page, need to tell a timeline or the budget and thing I share. So it's a financial share no yeah. I can tell a page. Let me just Okay, I think we're good to go. It's okay, Nima Fenken or sign. Yeah, okay. Assalamu alaikum. Thank you very much for joining us. I'm Efaji. Welcome to the Digest News. With me today is Kadi Toure. Kadi is a survivor of FGM, a campaigner, and the community outreach director for Oxford Against Cutting. And Oxford Against Cutting is actually a local charity here in Oxford fighting female genital mutilation or circumcision. And the reason why we're out today is to discuss the link between FGM and the complications, basically, the childbirth complications of FGM. And oh dear. And and I was supposed to have Sarata and Fatu Balde, but Sarata is now unable to join us. I think she would call us later on. And F Balde would also call when she can. I think they're unable to come in right now. So I think I have put a WhatsApp number that you can ring if you want to contribute. Just to give a background, the reason why we brought this topic today is we all know in the past couple of weeks, the whole Gambia, I would say, women especially, have been saddened and angered by the increasing number of people or women who are dying during childbirth or immediately after childbirth. And a lot of causes have been talked about, the reasons why this is happening. But I noticed that a lot of reasons have been mentioned, but FGM wasn't one of the reasons discussed, and we know why that is the case. We know that FGM is a taboo subject, and we know that a lot of people don't feel comfortable to talk about it. So I think it is important, having experienced it, And having worked with women who have experienced it and knowing what we know, I think it's important that we come out and discuss this and try to find ways of advising the nurses, midwives, and healthcare professionals in how they can integrate FGM into the maternal care that they give women when they're pregnant. And so Kadi is going to speak from a survivor's point of view, but she is also going to speak from a professional point of view. So she's going to narrate her personal story. And hopefully when Balde manages to join us, she would give us an overview of the research that she's done when she was writing her thesis, because she did something on obstetric care, the experience of women who have gone through FGM. So I think the insight she would bring onto this discussion would be really relevant and useful. And hopefully Sarata also would join us. So mbadi ngolungal kontong kal bisimilay jang Info Digest Network la platform oton telem FGM. Ngkom fintita na menna bi wala mpurunga nying nyaka tutakuo kachaning mantoro la kameni ke musola ni be wulu wala. Bayri nal hakilo ba kan ni wato be musol kamfata musol dewunta nying kuwala meya lon ko wala maternal mortality ti musol be fala ni tata timoto wala ni wuluta just wala jannin fangoy be wulula bitum kacha jamal natake ka jibe munati na musol kafa endung wokono fenjamal fintita jele mentata membuko infectional aning yele bongol aning kamele bonyento bari ngamira ko fenkilinde manketa kacha nyento wala nyi nyaka tota koti bari mbuka ko kacha amu tabu subject lati amu fenati meyalon control maka comfortable ka kacha so nko nga finti nang bayri tol nga do ko kele ni musol men yalon ko itata nyaka tole andun tol fango mo survival lati nsinano janni nga hakilo di nyola nga kacha nga jibe musol men be Gambia bayri Gambia 76% of na musol between the age of 15 and 49 will be tata nyaka tole nga finti nang nga ko kacha ka jibe musol no sol ning midwife will ibe musol makoy no la nya dile extra support for musol menialon ko itata nyaka tole ka tu hakilo kono dal ka care ka FGM ta ka bole care plan on yin kono nibe antenatal or maternal care dila musol. So welem fintindi nanjang nga appreciate le ko FGM mo topic leti me alon ko is very sensitive nga lonno ko mojamal man comfortable ka kacha. So bravo to Kadi ate meng fintita nga sawarta sonta kana ka kantara nyin kacha to bayim tol mo campaign leti son tol ka nyin kacha le normally so buka mang any difficulty sort of pruka ko kacha but in al natural membenji bekan you might be uncomfortable to talk about it but in nimmen lafta ka call ke no WhatsApp number ni tole kela on experience so wala ni lafta kan hakki la farang fengo fenna dorong ya lafa but I would indulge everybody to be professional and diplomatic about it, to be mature conversation or sort of me along control be nafa sort of jela because wala ti no wolita. So when I posted this earlier on I had one comment, somebody saying don't attack Islam. So be manta do na come for FGM betia ta fama betia wala for dino thing manta do na wakono FGM kamo batandi nyameng na bo bulula. I guess that's what we want to talk about. So Kadi be bismillah la jang digest news nyunto ini moli nyo kontong then ngadun kachakon. I think what we're going to do, we will mix and match. We'll speak a little bit of English ntabe fendol fonola wolof tole and then ngaji be kachanyim betala nyame. Bismillah.
Yeah, assalamu alaikum wa rahmatullahi wa ta'ala wa barakatuhu. Mbadin Gambia nolu ntala mbaka di ture. Uluta kombo gunjure to bare birimbe 5 years. Mbe ngana life beke sukutale sabiji. Jamba kunda mobe lo waltonu ngajela kalamta dan gunjur because na family is both in Gunjur and Sukuta. So nata nan jambi komi efi afu nyamin dorang ay kumo banne. so nalisa kacha musola bari atemu survivality anunta fana mu survivality so andung mbe tata nyaka to le andung like survival mum faranti like complication during childbirth and so on so nga fale yaw nyame so na lafta anything in kala dorong alsa in kano ni lafta a question or type or ya for you calling coming ilafta meaning in kala ya for yeah, coming to English. Hello, everybody. I'm Kadi. Come back at the commonly known as Kadi Ture. So I'm here today to talk about FGM and complications like obstetric
Kadi?
women's.
Kadi?
Yeah.
Sorry to cut you short. There is somebody on the line. Amari Kuala credit on you. Maybe Amansia Bake. I'll have to contribute quickly, then we can proceed.
No problem.
Yeah? And Kewaleng, so it'll be interesting. Sorry to cut you, just to hear what you say. Hello, caller.
Yeah, hello.
Ha, ika moile Kadi.
Ha.
Abi tanate abaraka ba kinke moile.
Yeah, shukran bolbe.
Baby Jan.
Yo ngala program moje live show kumbat pananga kafuje na londo ni na miro ani na jamano venyami Gambia kurunga yuso hakilo
Ha.
Osi hadamari hakilo fuka nyuso watu kanyoso hakilo. Yo komen musola ni nyaka ruta tonya bi mendo bi Gambia nyaje infection o shara Gambia baba kele so bari o man sakunda e wuli ayalo muna mudalilo di infection o nyika so nyame so komi molla miro to nunto na ado men keke kake musola wala hadi jo fanta gulal bije anyan tadalla dame na tambido dum aka torale yo bari fo na mole wuli londo nyini wodo na jaral bundala watu mafanga ya be munati na kake yo musolla nyaka tuta Gambia watu doli ninata yaje na lonna dolbije wol safo ko koren kira la sunnolo yo dolbije wol safo ko akamuso torale tonya nyimfulo baby jele yo bari dalilu le fana belare nji because nundo niaje ikake adolo molka ke kabiri nata yakar ko kilaje ko ikake ako tonyalo abijadal baray dandula de fo nyanta danna dame yo bari ndelle Gambia musola nyaka tuta sinya sable beje number 1 in 2 in 3 yo number 1 in 2 in 3 niake musola fana bi nundo molka ke nundo melka ke ye bor kendol so wulol ko no mialo ke ati bar sani melka ke ye boro so to ba fuy mo boro so ka boro jumala kije fu moli lo yo fana keskesi fu fana boro ni beta la fama beja because nka to la kibarol moy kany machine tulol le kije wala ni capsule ten ka boro le kije miango abuka ke bor kendol de mianga mo jarano so na bo nyama fokata hakilo la ka kacha nyotema kalon ko tonya na kolya kulbi damin jang wolo minda manke ko mel fanan ka ko aka muso tora wol ba ke kan ko men kan na adun buruga hani aman ko ti dun to mel ka ke because ni abu muske ba dole ka ko nan ngay ngele na kele mama ya ke bari wato borol min be ke bi wo borol te ken Gambia Gambia bi ikata lo tano do han badda so min badda so de ko se lo tano so ni mul be calculate ji jamana anala jamano lo bi ndeka porol menke ni ngal mul samba din kuyan onya musola ngawro ala sutro dilalo mialan ko ni iya blalo be so ni u barama imam bori kelle ki je min ba jarala no sini so akana ki dimine ke nakete dimine do dimine ko ke muso yi porolde and wo muso fana naketa e porolde nani ki ko fa ka ke porolde ki o fana nimbi na jamano kan Gambia bango kan bi avec ke jamale siyo do ya ga muso jamale siyo do ya ga ba ni mo ya fo isa fo ko mo be kila la sunno le fenge ga no amma ke kila la sunno mbol fenge ga kila dandula fa ya marul ke ko me yedo madimboni
ako ni ba kela is option actually ama fam ake ako ni na ba kela ya
yalo sunnolo ma ko ko men farlolo ma ko na ba kela yedo madimboni yo ka ya do na bondi le foke ma do ka mu mi ko la bondi so ke na e ko nte mama wala nte ba ma ka yinkele ite man na you practice yani ki aka borol men ki yete moron ndu borol men ko so sa won ko so ite na prawdo yi ko to mo ngaldi mbade ko kono ka ke la dum bi we dum fo bu ko jara ada man dol bi ni ba ma ila dum bu ko ñoom da kono ko kat dimin dinne santo jara da so woka ka way dimulati no seni no dimin tato wo kono do wokana problem wo di wala wo yati na ko na bango kam bi musul be siya mel ko kono tu be la aka barna aka problem jamale samba sabun hani skin infection o min be aka be sabun ne ko kam bi
to nyaalo
so bango ni kam bi infection o be siya ngel mi an ko barna bari wato do ni da ro sa do wato ko ngol fan ko le to ko na la fan ni frère fan wato do le no bari ni diam do le ta ko ka ta to ba ko le ba fan siya le hani ada madi na ta dunya dan puri do ko le ke madi na dunya dan ne puri le ko do da dunya dan ni la ko ni mam be ya alkiyama be ya no la
tonya
on dan wala har madi nga kuron soro nyaadi le infection ko soro nyaadi le man ta kunda nyanda lola wo no male yuke mu la ko kendo ti lo ni ka soro no nyaadi le bari ngal la mo li wado ni ko mo soro e ala ki da no o man ke dalilu fo longo le nyina ko no mula na nyika ke ko ala ko dunya kabra e na dunya da ko le bi jom so ite na de ay ke wulli kalifu di wul be nyanda do ko kele tele ite nyanda longo le nyina na wala na kabra kila alifu akwai longo le dila hadin na kila Muhammad sallallahu alaihi wasallam kabrana da kai ne kufuru ka ay longo le fay so longo fomol ko nyini fomol yo nyini muna na nyinka ke man na chance dila gambe ding le firoke ka gambe ding londin de nyini muna na nyinka so mal be ten la mba jaila
baraka
Allah yin kada ko kendo mi ango alba ke kan abida da bakele pour que mo lolin muna tin ni ka muna tin ko don bi ni diam de wol ba ne ko ite ka kila na sunno le fo mo kana gen hani amon tawti
baraka
amon ko ni jamano bento bi borul mandar sodo kan gambia bo kendo mi alba ti mo la tin jarano so baramo to ni ati mo la na man jarano alongo wo dibi ni wala bina o kala wala sato
asina batande no na ba wala
modul ka jambar modul tan je mi ango wali ka jaw puri ko do soto ya ko don ke man dalilo fa so ya ni de jamala pete na dalilo soto ina tin be dia mo kan ko yi
so nya
wala hadama ni dunya de hadama din ay balu be kala dala jatolum aniyu nala hakilu so hakilu fana ala talla na 5 comment sense anana sufu le kada wo haramadin jado bala wolle ka kibaro di haramadin la so kibaro di haramadin la wo nanta itan lan dalal ko yunto nyaje muska ke tonya kila na sunoron bari wol ka ke nyadile adumara niya ke ka mun gorin gorle ke faka ya no mul bukat man toroso ani sa mudan na mul niya ke ka man toroso ko jambulu dalilo ki nyanga ko mol nyanta kala wala mol nyanta haramadin la baru be tora la dame mol man nyana continue la wala tumba bi tendo lamba kela
abaraka yana ku mo nyinyata bake like thank you very much I appreciate it
abaraka
kadi ngamira nying I nearly half of lafta member for I afole I think I kufula raise like two important aspects memo infectionity I think the fact that komodol bije ni nyakata take santo se heal no le body konoto buka heal so it was starting na ko fawani data wuludu lato you know it's a complication also to no jeto bari janning be bula la ye continue ngal ne be dula to just pause nga nyi welcome membe jang nga iPhone dollar so to jang jumale be line on is that Fatu Balde or Sarata?
Hi, yes, it's me.
Hey Fatu, how are you? Welcome.
So I'm just keeping myself on mute because of the kids.
Yes, I understand. We have to multitask, isn't it?
Yeah.
Yeah.
Okay.
Welcome. I would just like to allow Kadi to finish. Kadi, mune konton diro banne number.
Abla continue
It's okay. Yeah, if you can just maybe just greet the viewers, and then we'll go forward. And maybe Fatu, give us a brief overview of the work that you've done on your thesis, the work on obstetric care. If you can give us an overview. Some all of them dinañu dimbale.
Okay, thank you, Fatu, and thank you for inviting me. My name is Fatu Balde. Suma background is sexual and reproductive health. I hold a master's in sexual and reproductive health from the Queen Margaret University in Edinburgh. So I have been doing a lot of work around female genital mutilation, but specifically on its impact on maternal outcomes. So throughout the obstetric period, pregnancy, childbirth, and post pregnancy. So that's overall my work. I used to live in Scotland, where I did a lot of work on that. For my master's dissertation, I looked at the impact of female genital mutilation on pregnant women living in the UK at the time. And that's how I got actually started on the work that I do, my activism and fighting against female genital mutilation and raising awareness of its impact. Presently, I work in the Gambia. I run an organization called Women in Liberation and Leadership, WILL, and our focus is again on sexual and gender-based violence, and part of that we do work around sexual and reproductive health and rights. Yeah, thank you.
Thank you. So Kadi, ngamurun nang ya potenke.
Yeah.
Yeah, continue.
Okay. Yeah. Thank you, Fatih Balde, for that one. I just started introducing myself, but we need to give chances to a caller on the line. My name is Kadi Ombakadi Ture. As I said, I was born in Gunjur, brought up in Sukta since 5 years. Went to school there from primary 6 Sukuta, then went to Muslim high school, completed my school in 98. Then after I went to Gambia College, because all along I wanted to do midwifery in Gambia, but I wasn't given the opportunity because of how the admissions and so on. I've tried that one for 2 years. I couldn't succeed. So I went to Gambia College to do higher teacher certificate in science. So I taught at St. Peter's High School in Lamen for 1 year, and I taught at Sukuta Secondary School for 2 years prior to moving into the UK in 2005. But I was a youth campaigner since I was back home in Gambia. I started my campaign when I was 17 years old. That was 1995 with Amnesty International. So I used to work with them a lot. I started as a volunteer campaigner. Then I was the women coordinator for Amnesty Gambia. We used to do a lot of meetings like strategic campaigning and mostly Amnesty's work is based on prisoners of conscience, but we do FGM along. Sometimes we go to the provinces or other places to campaign against FGM and so on. And I've attended a lot of campaign work, strategic campaigning in Dakar, St. Louis, and I've been to Mali as well for the strategic, which most of them are regional for both West and Central Africa coming together, either in Senegal, Dakar, or St. Louis, or Mali. So when I moved to the UK, I was still doing my campaign with Amnesty Online. But after, because I can't attend the meetings with the local group, so I was doing that one until 2012, when one of the doctors in Cis and Iris in London moved to Oxford 2012. That time I was pregnant with my twins. Then I was under her consultancy. She's obstetric and gynecologic doctor. I do chat with her when I'm at her clinic. She do ask me some questions and so on. So until she later knew about me and my work to end in FGM. So she said to me, Kadi, why not we form a group that can support survivors, because all that you've been doing with Amnesty is supporting survivors or campaigning against it. I said, yeah, I will happy to join you. So that was how we formed Oxford Against Cutting, which is a local group based in Oxfordshire at the initial stage, and later all over Thames Valley, due to the fund from PCC fund. But we start with Oxfordshire, going into schools. We trained a lot of teachers, over 2,000. We went to over 2,000 schools in Oxfordshire, and we trained police force, both their frontliners, and we do train the healthcare.
Kadi, OSC is taking over my show today, so I'm not gonna.
Yeah, so
I'm not gonna fast forward us too, because I know you have an interesting experience.
Yeah.
And you have a wealth of knowledge and experience in this field. But I want us to focus the conversation on your experience actually in your childbirth experience here in the UK, some of the complications that you had, and then we'll try and see if that experience match with what the findings of Fatu's work.
Yeah, it's true though, because I do compare myself with those women that are dying during childbirth. I'm always happy to share my story everywhere I go, and I'm not shy to share my story. I was married. When I had FGM, I was just like a baby, not even 1 year old. But I don't know nothing about FGM by then. But as I grew up seeing my younger siblings going through it and how they are, I felt a lot about FGM, and that was why I joined Amnesty International to stop it. So I didn't have my period until I was about 17, 18 years old, very late. So when I start my menstruation, then after I always have like a heavy period. Even now, still now, I always have a heavy period, or pelvic imbalance or pelvic pain and so on. So when I first joined my husband in 2005, it took me a long time to conceive. Even when I was married, my husband came home a few times, and when I joined him, it took me a long time to conceive. I came before so many people, and after I have to go through tubal patency. I think Fatu Balde, you might know that one. That was my first anesthetics operation. Tubal patency, that was in 1995, around end in November. So they kept my teeth wide open. They are all wide open, but I can't conceive. So after, later, when I was finally conceived with my first child, I was told that time my husband was in the army. He was in Germany. We are there. They knew more about FGM than UK by then in 2005. So they said to me that you cannot have your baby naturally. I said to them, why? They said, because of what happened to you. I said, okay. Then I was going, they said I have to be on the consultancy. So I think I was like 7, 8 months pregnancy when we moved back to the UK. And they said to me in Germany that we have to write into your blue folder that when you go to UK, you have to be on the consultancy care. And week 33, they have to do a test to see again. So I came with those notes. I gave it to my midwife, and she followed up. I was all my pregnancy, I was on the consultancy care and my delivery. So, but unfortunately for me, unfortunately, my pregnancies, I've never get sick, even a headache or anything like throwing up and so on. I've never get, I will be pregnant until before you know it, I only have the baby. I remember one lady, Ghanaian lady I used to work in the army camps in their kitchen. She always said to me, I have to tell this baby that he or she is a good baby, because even me, I'm disturbed with this mess, but you are not disturbed. He or she is a good baby. So, but unfortunately, it's the labor that bring the complications and problems.
Mm-hmm.
My first one, my labor started on Friday. I called the hospital. They asked me to go. I went there. They checked me. They said, oh, it's early labor. You can't have the baby now. Maybe Sunday or Monday. I said to them, then I'm not staying here. They said, okay, we have to put it down and you sign. You can go home. Then they wrote it down, exactly what I said to them. I signed. I went home. I came home from that Friday, Saturday, Sunday, until Sunday late. Still now, I started a bit dilating. Around Sunday, around 10 p.m., I have to go back to the hospital. I was only dilated 4 centimeters. And since that Sunday, late Sunday evening, until I had the baby around Monday, 5 p.m., with 4 centimeters dilated, not increasing at all, every minute of contraction. I was lying on that dying bed until like I had slow progress in labor, serious complications, and fetal distress, which is life-threatening. So my midwife looked at me and called another midwife. All of a sudden, the room was full with consultants, doctors. They said straight away, they took me to the theater to get rid of the baby, to save our life. I was on my theater, I was on operating bed. I said to them, I'm not going to sign this. All that came to my mind was the Gambian women, when they have operation, they die. And that was almost 14 years ago. I said, I'm not going to do any operation. They begged me. I could remember one of the consultant lady, doctor, hold my hand, another one hold my hand, begging me to sign. I said, I'm not going to sign it. They said, oh, you don't know that 80% of the women, when they have cesarean section, they end up having natural birth. Just sign and save your baby. I said, no. After I said, give it to my husband to sign, they said, no, you're going to sign it. Otherwise, we can't do the operation. That time, they were already done. Everything was said. They're just waiting for me. After I did pray to God, I said to Allah, I'm in your hands and my daughter, save us. So they set up everything by then. Then they did the epidural. First one doesn't go through. They did the second one, the same thing. Until the third one, they asked me to lift my leg. I couldn't. They said, okay, it's perfect now. Within 2 minutes, the baby was out within 2 minutes, because that time I could say there are more than 10 consultant doctors attending me.
And you and baby were all fine.
We are all fine.
Okay, hold on, Kadi, to that. Pause for a minute, because I know it's a long story, and I go to Fatu Balde, because Kadi has spoken about a lot of issues that we are hearing now about women that are dying actually in the Gambia. So, just listening to Kadi's story, her experience was here in the UK, but she talked about prolonged labor, and a lot of women did share that story, actually, that experience, that when they go to labor, they have prolonged labor. They have what do they call it, fetal distress. So because the labor was prolonged, the baby inside may be distressed, and then that leads to C-section in most of the cases. And we know this is very common in Gambia. It's not a new story at all. And that is why we thought it's important to kind of sit down and think, what is the link? We're not saying that women who have not gone through FGM would not have these issues. No, that's not what we're saying. But I think so far, the researches that I've read, I think some of the outcomes or the claims in those research was that women who have gone through FGM are more likely to have these risk factors that we are talking about. So the prolonged labor, fetal distress leading to episiotomy, like the tearing, when you have tearing, when they have to cut you to get the baby out. So Fatu, I just want you to I don't know whether you have anything to add on to what Kadi is saying. Is it correlating with what your research work was on? You know, just to see where we are.
Yeah. Thank you. I'm going to apologize because I'm outside. I just have to get out to speak because of the kids. So for me, this is both personal and professionally. I can talk about my experience personally. What, Kadi, what you have shared here, I am sorry you had to go through that. I relate to this. I had exactly the same experience. I've just given birth to my third child. He's just over 4 months old, and I had exactly the same complications. This is my third baby. All 3 babies, I've had prolonged labor. My first child was C-section. I've been the last 2 have been able to deliver vaginally, but all of them I ended up having a 3rd-degree tear, and I had to be stitched up. So these are complications that are associated with women who have had FGM. As you rightfully said, Fatu, we are not saying that women who have not had FGM do not have complications. But when a woman has FGM, your risk of facing these factors, these issues increases significantly. The WHO and other organizations have conducted studies to back this up, and they have found that women who have had female genital mutilation are at increased risk of cesarean section, distress of infants. Again, this is for me both personally and professionally. All 3 of my children, they would have distress at the end. For my second 2 that I didn't have a C-section, both of them I was taken up to the theater and I was on the bed to have a C-section. And luckily the situation changes. So those are all things that are very common. Now, when you bring that context to the Gambia, where we do not have the equipments, where we do not have the right structure to support women when they are in those situations, like the situation of myself and Kadi and many other women, I was lucky also to deliver in the UK. If that was in the Gambia for both my children, they would not have made it in Gambia. And the chances that I would have made it would have been very slim as well. So we know that. But also, these are the issues that we must take into consideration at an early stage. During my 3rd pregnancy, I was in the Gambia. I went through antenatal care. Not once was I asked about my experience of female genital mutilation. This was not recorded at all. So for women who have had FGM, so imagine if these complications are expected and these are not taken into consideration before your delivery. When you get to the delivery, and these complications occur, and these are the problems. We are seeing women going into private care, but the problem is because these are not taken into consideration in advance. When these complications occur, the doctors, the hospitals are not prepared enough to provide that support. And by the time they get ready to provide that support, it is too late for either the mother or the child.
That's right.
That's true though, Fatu, because me personally, I had 5 operations. The first one, as I said, was tubal patency. And my first C-section was like not expected though, but it happens. And even my second one, that one I nearly went into C-section because when the same thing, when I went to 4 centimeter, everything stopped again. During labor, everything stopped. The midwife I found there finished her shift. Another one came, did 12.5 hours shift, finished her shift. Then the 3rd one came, I was still at 4 centimeter. Until like second checkup, she kept me up. She said, oh, you are fully dilated. Maybe in 2 hours, you'll have the baby. But after I surprised them with spontaneous birth.
Spontaneous. And you know, what you both said here is interesting. You and Fatu mentioned something about the antenatal care that you get. Fatu, I know you are out, so don't worry. If you mute your mic, we know you're busy, and then you can always join us. Fatu mentioned something about the care, the antenatal care that you receive in Gambia. And she said that often, well, in her own story, she wasn't even asked about FGM.
Yeah.
And I know that a lot of women are not even asked about FGM, and that is because it's very common in the Gambia. So, like, we're all part of the same system, unless
they think it's just normal life. So it's not anything that is like sort of complication. That's why many women are dying, because even me, as I say, my second one, the midwife kept saying to me, hope this time too, you're not going to end up having cesarean section. But luckily, when I was fully dilated, the baby cannot come out because I was too tight.
You were tight. And that's another thing. That's another complication.
Because of the they did. And they cut me off to get the baby out 12 years ago. That scar tissue is always there. It's even worse than C-section, I can say, because it can sometimes swollen and it can hurt and so on. And with my twins, even when I was pregnant with the twins, I woke up to 2 days to my due date. My managers have to beg me to go for maternity leave. They kept saying, we don't want to have these babies here because of
thank you again, Kadi.
And when I started that one, they said they called me a meeting. They said for twins, the baby has to come like by 38 weeks, and I am 38 weeks by then. They said they have to do something. I said, please give me, because I want to have these babies naturally.
Okay,
I think Fatu wants to come in there.
Yes. So what I wanted to add also, as we are seeing from evidence, both scientifically and our experience as Gambian women who have undergone female genital mutilation, because what I tend to find in the Gambia, a lot of the time people will deny that this is actually an issue, that FGM affects women. You will find a lot of people, especially Gambian men, I am sorry, and even women sometimes, arguing that these don't have complications on women. But we are all here. We are Gambian women who have had FGM, and we are talking about our experience. So we are not just talking about the issues that the WHO raised or another European has studies. We are Gambian women saying that these are things that has happened to us. But what I want to buttress on is the issue of C-section. We are talking about the increased risk of C-section for women who have undergone female genital mutilation. What I discovered during my pregnancy is the pressure that Gambian women receive not to undergo C-section. That is something that we need to discuss. Yes, it should be, if you want to deliver vaginally, and you should be provided with all the opportunity, all the support to do that. But if complications occur, and to save your life and the child's life, you need to have a C-section. That should also doesn't mean that that woman should die, but also the pressure that as a woman, for you to be a woman, you must endure pain, you must endure natural birth. These are conversations that we need to have, because I remember sitting at an antenatal setting. I was sitting down. I always listen to the conversations that women were having, and one day the women were advising each other. So deme bul nangu ñu operate la de bul nangu danga muñ so buggee sa doom mu yërëm la danga wara feel métti bi doom bi danga ko wara jur. So it's like wow, so it's like this sorry again the noise. This pressure that is put on women, that you must take the pain, even if it means losing your life or your child's life, and the stigma associated towards C-section, that is something that we need to dismantle. Because I saw that even when I was in labor, the doctors, they kept telling me that muñal de trial rek nga muñ nga muñ rek nga nekk jigéen. And this was in a private hospital. I went to Dakar because I know the other thing I suffer from is postpartum bleeding. I bleed a lot after childbirth, and I knew if I delivered in Gambia, I would have died. And I couldn't travel to the UK because of the COVID, so I went to Dakar to deliver. And exactly that was what happened. I almost bled to death. They had to put me on a medication that put me back on contractions for 12 hours after my delivery. That was the way they could control my bleeding. But these are stuff that are not available in Gambia. Just to have blood standby. What I advise women right now, if you're pregnant, find out your blood type, find out who has that blood type in your family or friends. Make sure they are on standby. This is a message that we need to send across, because we know that one of the most common causes of death, maternal death in Gambia, is blood loss after childbirth. So since the hospital are not having blood banks enough to provide for women, we must find alternatives. Women must be prepared. But again, these are conversations that doctors are not having with their patients prior to them going for delivery.
Though, it's true. If I may add into that, as you mentioned, it's true though. Because here, when I said I want them to, they called me a meeting, the consultants. I said to them, can you please give me another 2 weeks so that I can have natural birth, because I want to experience it. But they told me everything, like the complications because of 2 babies inside me. But that 2 weeks they gave me, every other day I have to go to the hospital for scan and CTG to make sure the babies are all right. Every 2 days I have to go there. And if I'm not,
I think the care cannot even be compared. Like here, when they know that you have FGM, like just having FGM on its own, it's like an ailment. You know, you have a lot of consultants and extra care actually, because they know what could go wrong. But Gambia, what you were saying, what I hear you say, Fatu, is that nobody even noticed or talked about the fact that you had FGM.
At any point. And
I think for me, that's where we need to start. Going forward, I want
but also,
to see.
Fatu, so in that case, for me, what I'm trying to put across, in that case, for a woman who have had FGM type 2 or type 3, imagine when you go into labor and this is not taken into account. Imagine a woman who has been infibulated. A lot of people are saying that mutilation doesn't happen in Gambia. For me, FGM type 1, 2, or 3 is all mutilation for me. But people argue that the extreme part is what they call mutilation. Fine. But what I'm saying is we do have that type of FGM. I have met several women and girls in the Gambia who are infibulated. So if you haven't taken this into consideration for a woman who is going to deliver until they get into birth, what are you going to do? So this is something that we really need to advocate for. We need to remember over 75% of Gambian women and girls are already victims of female genital mutilation. So it should be factored into antenatal care.
Fatu, I think since you are in the Gambia, you need to work on that a lot, because like as I said, my second baby, they infibulate me. But even though they infibrillated me, the twins, which are my third babies, I have to go C-section directly. And my second one, I was even on the high risk consultancy care. They have to deliver the baby 2 weeks before my due date. Deliver him 2 weeks before my due date, because I was at very, very high risk.
So these are the issues.
Okay,
these are the problems.
Somebody is saying, can someone speak in the local language? Yeah,
that's true. That's true.
Saja, thank you very much for that. Ngamira wo kumaya tale. Ba summarize la domanding ngamino for jan katu ngamira kachanyin kumaya tale. So far, ngamem for mbela feeling hamo momenti as a society sign. Bari nyi musol men kafati ngota siatale. Hamo momenti walem ka antenatal care nyingi kamendi musol la nin kono bela. Ngamira discussion on nyantaka keleng mbemem for kanjang. Ka long for muso tata nyaka to famanta nyaka to, because ngamendu jeko wale ka muso batandi wuludula ijama a consistently with research ye men yitande anin tol fangol mele tata nyaka to ngamen soto comme fangol men buko ka me wuludula muso men tata nyaka to kurate me wuludula comme ngamen fo angale to wala nyinti ko mafo ko muso men manta nyaka to ibuka nyin complication or soto de wala nyin mantora kolde e ka soto le bari nga men lon ko menu tata nyaka to ila mantoro nyin wala fanang be puri nyin mantora sifa soto wala haita wala siata kadi nga metere manika ka mo enteti
wala mbe min fola doron kamin fo wala nyin ko musol ka mantoro mini soto nyaka to tala mantoro, because ntola molu Gambia nolu ibika afo akoindi molla. Ngamira comme na docteur anin na nosole nin musol nyanta sila nin kono bela ya ko indi la ko nyinne be kala ni nyinke because birinta una wulu folo birin ko manta sayna ya fonyele min be kere because interdata matani lebo to bakele interdata bidding ara jumo fo tenon ularo 6 or 7 p.m. So nyanta be ko indi lela anu na fulandingol fanan comme ka kumo sutiyandi doro na fulandingol fanan bidding ko ilafta kan operate 38 weeks nko embalal fo lokum fula purun se wulu non fangoy bari ya ko yen sindi mitino lale ya be ko indina ani konya ko fanan ko sayin tilifula wo tilifula inyanta kana loptano to ni nata loptano to nga scan ke nga CTG ke saji be fo dinol nyinbe ibe ke kuri na wale man tara ke kurin kono kon ni oji be ndala fulan biriyo ke after ntarta wala tilifula wo tilifula ngata je fo 40 weeks konya yen operate biriyon operate anu na because ndingol fankuliya tale because na baby dama na kambanding wota tale for 9.5 pounds and na sunkutun ndingo tata for 7 pounds doctor lingin consultant doctor nya konya ko min just the babies alone coming ndingol dama tata for over 16 pounds. How do you cope? Okay, God, it's God that saved me. And na labang ofana mi alon ko consultant ol mini be haita mini alon ko be santo yenke wole la keat so wo fana yen operate le lokum fula jani na wulu wato so coming nyaka ta do gambia ka type 3 kele because nyin suki rol be mu type 3 let nduni ye suki ikatu wala nyame yente di infibulate le bari coming kam fanundi na wulu fula nyaonyi bari hani sai woye madi o min tumbala hani sai askati sunyin hani sai abembala
kadi post jeto because lafta ka domandi nyambas woto ye dula malek skati sunyin wala barama nonyin because skati shu ni musola musiyabe nyamen and just to make it clear that when you're replaying this and watching it, make sure that you're not watching with small children, because we probably would say something here that might not be kid appropriate. So I just want to make that clear. But here dulale ma equals scar tissue. Musola wulu dula be nyaming scar tissue ni be wulu kan normally dilation or well and fan. So ni be wulu kan naturally alay muso da nyame ake fanondile ni prudini way finti. But ni scar tissue to je yemadi no soto je to woka konne andu ni dundi nyakato le ka kon e ka wosoto jama so ni wo bela musiyato ile musiyati fanu nola pro dindi mo e fintina so ikaje wala tina modol kam me lebo kono pour que tara pushing na dindi mo te fintinola because of munem apoka stretch no katambia be nyame na ka be stretch bala wala na modol ka fara e ka faro soto wala doctor fama na episode aye to kuntu pour yegena fanu so mo nyanta ka lonne wo sifa ntingamira nin kono bela watata ko ibita kan care soto ka mata antenatal care soto ka be nyanta ka chalale kayita ndila ko ite be make expect la comme itata nyaka tole nyine be ila situation of wala nyama there is a likelihood that come be la falale because ndena woso tole ya o e fontaine ko be la falale you know because of nyenati nambe la fal yaje muso nyin ya long abe men expect kan beforehand and what the toying because people can stretch no back wala katina dino ka bata kono do bije hawji yete operate ni man kaya kendo soto inyo tuje so ngamira ko that aspect of chatting about it beforehand ngamira ko what important there is somebody joining this call and I don't malong for Sarata Lembang but I don't know Fatu ndah buga ngawa who is this place is that Sarata hello who is this? Okay, I'll have to take 1 second, Kadi, because many Mari expect junk. So I'll have to delete this person. I haven't given this link to anybody. So unfortunately, for our own security, I have to take them off. Sorry, Alimbala, because somebody came in with a very funny name. I hope we are not hacked because we're talking about FGM.
No,
I hope not. Okay.
Mol nyanta kadi so because ntanga wo so tole na fulanja anu na wodol be mo operational. Na operation dula jebe smoothly ne kombalo be nyame ibi ka lon fan ko yen operate ibi ka lon fan anonga operation lu lesot ibi ka lon fan ko yen operate bare skati sunyi ani sai wo kunturol bije 12 years ago and I will live with it. So I always call it pain for life. Because niko kila sallallahu alaihi wasallam ko alka I ndafe ayama roledi sort of dandalaro because nali bakela alkana dan natambi and in coming
bakela is it's not even said alake I don't even want us to go into that conversation
because one choice let so
I
think dorong kata ngana muso doctor ol nte bole appeal la dorong because dobi jakam bala fale ninga moy ko muso fata wuludulat it made me to reflect back on my days when I was having children because I could remember no na cousin Donatan Jibeja wato na last one obiri wulutala 3 weeks na dinding flandim flow because it all close tanyola only 14 months between them na flandim flow be push care kono bogi kono dindi manyi woben siso kan sitirinte nyimbamburang biri na fa akonyo ko society kan yimfu nyode man la ko ye operate ko je ni ma operate nta fole na yo yayo beken na city center kono fol seta so kono ngata ndial akonyo ko ntaman operation daje ta so ye operate mun ton kai fa my line ol and wo ya talo just 3 weeks ulut so
talking about that operation
bala fa wartale de altol mimbe Gambia kay ngali appeal na ning doctor ma because nim private clinical ntanga je ko na faman tarela Gambia so te ko ni ko be private clinic le nyanta ela everything nyanta tar la private clinic bare mine bati na itol fana nyanta la ka referral roke at the right time because
nyano minem kadi they don't really talk about the situation come ni la caring I don't know how it works maybe fatu safo no more but in conversation on yin kono ibuka yin aspects or maybe they give advice on what you need to eat ibe mine domola and all sifal be but if me ya lonko famoko that is what the nitty-gritty meaty part ni me alonko complication or mense fintino I don't think they do those sort of conversations so maybe fatu if you could shed some light on that just to give us an overview of how the maternal care actually looks like. What sort of conversations do you have?
Yes. From my experience, yes, I was using a private.
If you can say in Wolof, please.
You're Wolof. Okay. Sorry.
Wow. Okay. Man si suma experience, bima don go through antenatal care. Antenatal care, moy support buñ la dé jox. So biré bala nga dem so nurse Gambia dañ ko dé wax nurse soy dem nurse ñun lu ñoo waxtaan fi dafa ñu ngi include ne soy dem nurse si timing sa dem nurse sa docteur bi nga dé gis dafa wara sóoraale issues yoo xam ne dafa mel ni ndax jigéen bi xaraf na ndax xarafut loolu dañ ko war a teel a xam pour ñu mun ko si sa kayti nurse yi waaye just balaa ma move si loolu dama bëgg a indi another issue lu nekk problème so demee xam nga for instance in the developed countries so demee si antenatal care bi so demee nurse benn same nurse bi midwife bi nga dee gis all the time in hardly nga benen midwife replace ala su dee da nga dem si hospital waaye throughout sa care bi
unless they retire because I have the same midwife all my children.
Okay, so one of the biggest issue in Gambia, especially in the private health care, then they am different ONG, New Day, obstetric, I can't say the word.
I can never say it as well.
Obstetric.
Wow, a gynecologist, ONGB. Then they am the different people coming in. So most times, man bima don't access yep. If I saw this one during this appointment, the next time I saw a different person. All throughout suma appointments. Fogg na bena yon like kena nyari yon. That in itself is an issue. Because I used to get annoyed because every time manyo si suma antenatal care bi, I had to repeat my whole history.
So they don't have a centralized system like where they put notes down?
There are notes, but it's just minimal, just some few points they take. Throughout, every time I went for my antenatal, they would ask me, is this your third child? Was your first child a C-section? Was this, that? At the end, I was, of course, I have received better service and I had high expectations and I am paying for my service. So every time I was ending up arguing with these doctors that I am not going to repeat. But for me, what if a woman has had a traumatic experience and you're forcing them to repeat this every time they come, every time bu ñëw. So they jigen bo xamne la force domam bi matom dafa metti won mu ngi ragal si biram bi experience bu mu am yow say yu koku ñëwé nga bëgg mu repeatat the same story. Ngay re-traumatize jigéen. So loolu tamit is another issue boo xam ne dañ ko war a consider xam naa ne yi fi FGM la ñoo wax ak yooyu but man dama feel ne doctor relationship conversation between doctor and patients dafa war a improve man li ma gis from my experience is there is this power dynamics between the doctor and the patient, a big power gap boo xam ne you can see ne doctor bi mooy doctor bi yow you are nobody. So we have this culture of silence where jigéen doing they don't want to ask questions waruñoo laajte questions because yow jigéen nga yaa ngi war a dem man I sat there and said, what kind of pain relief do you have? Suma am deliver. Sorry, but I want to know, do you do epidural? Do you have gas and air? Suma deliver. What are you going to provide for my manage my pain be? You know, because I don't have to go through that pain. And they were laughing. Then Madam Ray. I asked that question, but that is my right as a woman. If I, you know, but these are all conversations. Then go where include where a woman is confident enough. Then where antenatal classes explain. Whereas you can have one-to-one with your doctor, but have someone who has a outside knowledge because medical doctors itam dolen muna blame because they have this lens of medical view. You need someone who can come and break this down, sit down with women, especially first-time mothers. But even if not first-time, every pregnancy is different, every childbirth. It's important to have these conversations. When you diagnose, doctor bi du waxa yow sax man I have been on several times. Danga ñëw nga tëdda ñu scan la duñ la wax dara wàccal everything is fine. Dañ la ne yëpp mu ngi baax demal. Man, I'm sitting there and I'm like, no, I need more information than everything. Fine. What do you mean? Oh, then you just la prescription, like nelane, demal jël garab bi. And this is again something that dema fekk dama nekkoon in a place ma dégg jigéen ñi di explain ne soo nekkee biir Gambia dafa am garab buñ la dee jox. Garab bi soo ko naanee def la dee miirloo di nga feebar ma ne leen lii ban garab la. And no woman could tell me ban garab la.
Because they don't write the names. They don't write the names. Well, right?
Doctor-patient conversation be. We need to work on it. We need to give women confidence. Doctor. Don't feel intimidated. You can ask the right questions. You can be reassured. And but most importantly, again, going back to our topic, these issues like this are incorporated at a very early stage on the set. Musa record bi ñu xam when you go into labor ñu xam ne kii jigéen buy ñëw nii labor dafa amoon C-section before or mu ngi at a high increased risk of C-section because dafa am FGM type 2 or type 3 ñu prepare for your delivery. Why should loolu they happen kadi yaa ngi wax yi fi private hospitals yi. That is the problem because private hospitals yi suñ xamul prepare wuñ nga ñëw ñu ne labor la ñu ngi laa test for dilating. They haven't examined you vaginally, excuse my language. They wouldn't leave. Man, throughout some antenatal care, there wasn't at any point where I was examined vaginally. So if I was infibulated, you will not know until I go into delivery.
Wow.
So those are the problems.
And that's what's happening to many of the women in the Gambia, and that caused so much complication during childbirth. Because ntola jang nsafo no manika kangal ntola jang ning birila dim follow for yedin gelle soto birila kono nya follow abe records katara computer kono le anda akatara file kono so and mostly fan hannata ni be on the consultancy because ikalon ne before ena appointment of all ikatela no tole ya jibe nyinni soto wati gemale ayas abe katara jele la folder to because inta hanin na la ban fan ninta appointment na folder mini baby je kane bele fena ikane bele fena ye compare Nsa for killing na last one or don't enter high risk. So what if I because pass through to complication or minila before. So na doctor fana ning with wifle. Mbalda na anyanta ka wole ke ali ala do ko muta coming ibenjo kan jinnal ali bala fa so you have to be empathetic to the women.
Yeah,
you have to have sympathy. But nana ma wulu Gambia de nana man kono taje bari ka mi moje wala nyentiko musol kata loptano tole ibe nenna instead of them pampering them jang hani be wulula iman sake malo because ite mom tolbe nga experience le iman sake malo inita fewo fenne badi lela.
It's very special. Andun fanang kadinga mara fati offendola for about kafoko ngamunya, like this stigma around C-section, the stigma around epidural. In fact, because ntenga wo experience totally when I wanted to use epidural. Yeah, when I wanted to use epidural here, my auntie was like, no, you can't use epidural. You'll have a hatchback. You know, and then I said, even if I'm going to die, I would use epidural this time. And guess what? Guess what? Munyal, daga wara munjigen munkirip. Maneko wa ma promise ko si kirbe ba pare maneko jela wirda bi nga wirda ma egga se l'hôpital bi manela defal dem ma epidural. And it was the most beautiful experience of giving birth.
You are right because ntafa ketan nale ni aje nga fetal distress soto anim fenko be because after being coming more kan yimin fo kana nyinta kana yimpengota kana nyinta because wala be na mind kono wala be na brain kono at the beginning.
The brain
so
was
after ikonyo ko ibe gaso dila na wala symptom nyimansia nga gaso mutal fula ba wala flat gaso nyinkot.
Hi gas ni hi.
Yeah,
why Kadi, I to add on you made a point about healthcare professionals. See, I think lately I think a lot of healthcare professionals in the Gambia are offended because of all the things that are being said. That they are not the ones doing the right job and that. And we do know that there are many healthcare professionals that are doing amazing job that are going out of their way to work. As you get the odd ones who, and that is in every setting. But if we are talking about that, we cannot expect healthcare professionals to do certain jobs if they don't have the facilities.
Absolutely.
That is beyond them.
That's
beyond them.
And in fact, this conversation around patient doctor or patient healthcare professional conversation, that system has to be in place for them to be able to do it, because it all has to be there. Like the NHS here, this is all a programmed system. Like when you're pregnant 6 weeks, you get a phone call, you get a checkup at 12 weeks, at 16 weeks. So this is something that's been set up from high up there. So that needs to happen in the Gambia as well. So healthcare professionals, you're absolutely right. There are others that go out of their way and they actually know what they're talking about. They know what they do, but they haven't got the equipment, the resources to be able to support. So I think it's very broad.
Consideration. Because nta jibe hanina force one or birin komanta o kela musundunga consultant musundunga doctor every morning she has to come to my bedside to laugh at me. She said, look, now you're happy with your baby, you don't want to sign the C-section. And nunca epidural mean for because some na first one on have that one young ladun, but na second one didn't la work. Okay, they even said it's the first epidural they've ever seen. Because
I experienced that too, where
and so when you take a doc model fana coming kejang ako most pregnant women in the Gambia need to be careful of eating kale.
Kale.
So
kale is that stone that they eat, like
bankolong
kodi. So what you want a good point
but also just to comment on that, when we talk about those issues, so during my third baby, just my baby now, during the pregnancy, I craved sun. I want kale. It's cravings. But that is a sign of iron deficiency. It means your body doesn't have enough iron.
Right.
So it's not that these women are seriously suma romban suufi seleñ buñ tek dama buga dem tibako dem leka suma jëkkër daf ma daan reebe saa yu nekk man suma rombee suuf rek dama ko dee maybe suma jëlee suuf bi baxal ko tàngal ko jam si I was so desperate to eat sand.
Yeah, you better know they leka kelbi.
It's because you have low iron. But again, if you go antenatal care, if you are checked, they would realize na danga am low iron. You dimbal la si lolu. Understand? So these are all things that you want to understand. And when we've been pregnant, you know what it's like when you have your craving.
Yeah, I think we've only got now 10 minutes.
This is why it's important to have this.
Also is talking about postpartum depression.
Yeah, you have to. I have to do the school runs as well. But I think we are almost there. It's very broad as always. We will never finish one topic. But I think just to wrap up everything, Linfi Watane so far, I think solution wise, because I think it's important that after a conversation we try to find ways of finding a solution to the problem that we're talking about. And what we are saying, I think the general consensus is that we want to see more dialogue between patients and caregivers, basically, from a very early stage, actually, so that these complications can be picked up at an early stage and managed appropriately. I think the key message today is that. But I think, you also mentioned about these antenatal classes. I don't know whether it exists in the Gambia, but they're super helpful. They're very, very helpful. Like you get an experienced person, somebody may have already given birth, and they can tell you their experience.
I have written to hospital. I've contacted them since my delivery to offer. I'm happy to go and do it for free. Like this is my background. I can volunteer once a month to have antenatal care, antenatal classes for women. And I know Bundung, the maternal hospital, they do classes for both fathers and mothers. And they have seen a huge improvement in their maternal care support.
Yeah. So I think if we can increase that, I mean, if people are watching this and they're healthcare professionals, because sometimes you don't really have to wait for management to initiate stuff. You know, as a healthcare professional, you can just initiate something and then see how it goes and follow it up and make it your own small little project and make sure it works. So antenatal care is very good. Like here, you are taught how to give birth even at home. You taught how to change nappies. You basically know everything even before you give birth. So I think that is also important. And this information about the KO and the iron deficiency, those sort of things, you will know it at antenatal clinics, because they will tell you about these things. You discuss about the things that you crave for, and they tell you this is the reason why you crave for this. So I hope that
also the medications that they're giving to the pregnant women, it need to be explained to them, because like in UK, you only have folic acid, which is in your first 3 months. After that, you don't have any other medications.
Only paracetamol,
Only paracetamol that you can take. Apart from paracetamol, you can't take any other medication. They need to be looked after. Check their blood pressures, check their iron levels. And because some people can have iron tablet up to the time they have given birth because of the low iron in them. So if you don't look, although we're not putting too much on the healthcare professionals, but we just appealing to them, like you, Fatu Balde, you know the experience in UK and you know the experience back home. So you are a better person to do that initiation, to talk to them, still now put emphasis on them, let them have the patients let them put the patients in the center of their care. And it has to be the patient's best interest.
I think she said she's initiated that. And I know the issue with Gambia is that sometimes you initiate something, you talk to them, and they don't respond.
They think that I don't know how to express it. They think that maybe you have another like Western mentality.
You are.
But of course, we are not. We would be naive to think that the service that you get in the UK is what you're going to get in the Gambia. But there should be standards. There should be set standards.
The basic ones.
Yes.
Mm-hmm.
Basic
Things
okay.
like conversation, like a conversation. Everyone can have a conversation, and to appreciate the fact that even though FGM is rampant in the Gambia, not and for the fact that people have been doing it, because this argument comes up as well. People have been doing it for centuries. How come women are just getting complications? That's not a fact, okay? Because
you can compare with the diseases that people will never get sick. And they have a lot of traditional medicines that can help them. People can have 15 children or more, 10 children or more. But now people are scared to even have one, because those times they have traditional medications and so all those things have been falling off.
Yeah. So what I want to say on that aspect is that for people to appreciate the fact that we know that FGM has been happening, and we know that people, a lot of people have gone through FGM. But what we are saying right now is that FGM wasn't talked about in the past. It was a taboo subject. We know that it was forbidden. Even right now, some people are not comfortable. In fact, many people are not comfortable to talk about it. Maybe nimbota jang modol ba falala ko ñu man kala soto wala ñu mala ha ñu me fallo. But what we are saying is tubabo lekejo. But what we are saying, namina na first caller, he kind of wrapped it all. Like more mako iwotulato lekaita before you kind of have to back up your arguments. But what we are saying is, we know from experience, from personal experience, that FGM does come with some health complications, especially when you're giving birth. And what we are advocating for is for the healthcare professionals to have this conversation. Don't take it for granted that majority of Gambian women have FGM, and women have to endure and suffer and be patient and persevere. And so you won't give them the care that they need, because ninga okay wrong. I feel that there is a conversation gap, kachal baby cake towards yele bongol ke, but yele bongol samana. Why are women losing blood, so much blood when they give birth? Why are women having prolonged labor? Why are women needing C-section all the time? And these all can be linked to FGM. There's a circumcision. Many be for young. Iba link no la to nyaka total. Muso ye me because ngamen for come near but scar tissue will be is linked to it. So let us not take it for granted. Kafoko musol ye nyaka total no before man complications to sign why nyim foka, because kisi role ketale sai technology waratale musol dol bije confidential ka ko nyin kacha finto ketale, so we'll be able to work on manke ko amantara sotoka. Maybe women were dying of FGM before, in fact, but because imagine there is a need to talk about it. There was no link to these two women giving birth dying due to FGM. No. So amanke ko nyakatata latina de nyakatata complication on lekatina. So ngamirako, that's what we are saying, and we are saying moving forward kadi nga kumalabang otwicha bulete la kumalabang for, but ngamirako moving forward nga nyinkuol men be for jam kachada mali be cool is one of the things member cool nying sulfur.
Moving forward all nyinti doronko musolu mfangol damal fanan kadi amunyoe coming kamusu kono mal nyin ka, because dolbi je kamalu ba kala nin kono bela, because musol fang niaje dolbi je fanan amanke no solti wala doctalti musol konol katare lale ibika tanos, because mina kete ka fulan kamalule pour ngatanos mol yalon ko ni njeje ba fula konol ben mina nebe malla ko yen fami yalon ko hani en hani nata ni ma to futu ko ba ya to futu ko ibe malla minela, because ni katanos fana wobe ma ko ilale baake, because at least inyanta mako role mini dilele ibol dilele, and then secondly fana midwife ol fana ya try yela do ko lo musol ka katara ulu dulato inin dimo be nyola wo dimo fang doron kanya ta fe dimo mi ya lon ko Allah subhanahu wa ta'ala fang le ka ben ma be wo dulat abeka malaika kije, so itol nyanta ka bala fa musol ye mako wo ulu dulato nyanta mi wo min bekele yake after sinafe bari comme katare nen kan katara kumol fo kaye comme tol fongol manke musolt, because ngama Gambia dol ka pil fale fan ke timuta wala fisa musoli so obe nyanta aputla into consideration doctor fanan yela doko ka nyama man fo ko comme imela doko ka nyama bari fanan ne musol tata je ya try a time soto with them yela history nyin long ya ke record bal at least comme Fatu Balde mean for every time not at a clinic auto I found repeat again, and that one too can cause post-traumatic stress disorder.
Yeah.
So
it can traumatize the women, huh?
Yeah, because you are
because yanon kadi Gambia muso come fatu ya fanyame muso ite ngamera inyanta fengo bele tano la I don't know whether it will camera control manke moleti bang I don't get it because ndol fana mo hada madingolti andu nga feeling sotole so ngamera ni nga mo be treat equally doro ngalon ko muso fana mo molti I feeling sotole
and
otherwise ita expect la ko muso I dibi mo sotolo ngala wuludula I have bad experience. I don't even think they know that we can be traumatized. Because
well, what learning important about because at least marrying as a nehanata non kono fa bala as kudosi no alale as a illness si no ala mi alon ko hana I didn't wulu wala kanyang depression or ni postpartum depression or cause ibika pare ka dinne fanamma ndong operation of an nata woto nta operation lulek and abes unta wuluwol bari tibabol bijane mini alon ko they have 6 children 7 children they have all of them ya based to operational ya based to wala so that was a time in UK fan ikakodo di 500 pounds ikadi musola ninkono bela pour que encourage ta wuli fan instead of operation obe ketajan ma for Gambia nintan woman ke no je bare comme nyanta basic things mean sotola woye tare blokon the first one olen silata operational but later part ani na last one obirin bitala tara na husband na anti dobija na telephone tata nyol akonya ko fete nyama tele kata operation ole ka drive ikata wulu ole kata operation ole ka drive ikakete after birin wulu ta fana an kai ko samin bitan kula ninga so bantambala konya yamire te nyama ma kan ni manke na wulu follow ta na manke na operation follow kai ko ndanin pareta operation ola ninga so bembala wato mbika wuli ba ninga so bantambala kata la nganku fonga seneya nga fenkendol du nganin fenko
kadi ngamana na time o sita le 3 o'clock
nga kata doron na mol ya kata nimbe musol fanan apilla nin kono bela ya try hanata ni mam fendol soto no barika green sol do mo be ila iron level on la fala abe itol fanga mako ila letal no silto ila antenatal ke anin postnatal anin doctor fanan o doron nom anin midwife oli ila do ko ke doro ye musol mako pour min maternal death ni talano banko kam because abala fa waltal ni ajibe musitin dingol dolla kono nya folo dol ma hani 20 years fancy ye tay fa abala fa wartal so mo kala file ni wuluta yela de nano landi sinka ye happiness sot ya bari yela de nano filiko mo waleni la de nano beta abala fa wartal so nga kata doro nga nakato danke min keta no nin ala ko min be kala o ka kele barin sen nakato dan ke doron mbal wala be kala na ko mala ba wati nge ya mar doron nge inene doron ni be kono bela ani wuludulata because wo time on a critical tabakele musole so nta so wala fono doron
abaraka kadi abaraka nyamera kachanying futata kumfa dulale thank you very much kom ngamen fonong dorong we're not sitting here as health experts, but we're speaking from a professional point of view and from a personal experience point of view as well. So, and it's not to, to discredit the healthcare professionals or, to show up as we're the experts. It's more to engage and begin these conversations because we know FGM is a taboo subject. We know we don't talk about it a lot, and the reasons why women are dying is very much linked to FGM. And we talked about the excessive bleeding, we talked about the fetal distress, the delayed labor, all of that can be due to FGM. So it's a harmful practice. It's a harmful practice among benefits.
And it's a violation of every right of a girl child.
Yes, it's a human rights violation. It's against the laws of the Gambia. It's against it's basically ripping the girl of their dignity. So on top of all these health complications, so we should all try. It's a very sensitive thing, but not to we shouldn't expose our girls to such a practice because of all the long-term effects that it has on us. So on that note, Bafala Dr. Olfanaya, healthcare professional, ko ibe doko menanga jele manki pon jututelale. As I said here, Dolbije, they know their job very well. Yeah, resources la boka soto. And that is why my first video, in fact, yeah, we talked about the lack of resources and lack of government commitment, you know, but in more conversations of this sort of, if people would like to share this, please do go ahead and share it. And if you want to engage further with this conversation, you can just write to either myself or Kadi and we can talk about it. Or if you want us to talk about something else different from this, do let us know. Kadi nga for ya baraka bake time momenta and yes, and in Fatu Balde fanang.
Because yalong kamol karandi ke awareness raising and sensitization, it helps so many people.
Yeah.
Those are mira ko do banyaming amantara wo nyama bar ni kat yamu ka e ka kachandi ni ka mari kachandi asala fila ko do ke la sawo bulaje andung asalon fananin kono bala aba mala nyami ani wuludula to fana aba fan mako ela no nyami. Yeah,
yeah, thank you everybody, and thank you our wonderful viewers for watching. Fatu, I know you are gone now, Fatu Balde, but thank you very much for your time. Until next time, have a good weekend.
You too.
Bye. Thank you, Kadi. Bye.